Prostate cancer is one of the most commonly diagnosed cancers in men. For many who receive this diagnosis, the initial shock is quickly followed by a difficult decision: how to treat it, surgery or radiation, two valid options, both effective in the right context. But the conversations surrounding these choices do not always fully explore what each path means for long-term health and quality of life. I am Dr. Ava, and after years of clinical experience in urology, I have worked with many men navigating this exact decision. Today, I will walk you through 3 important reasons why radiation therapy may not align with certain long-term goals or personal circumstances. This is not about discouraging radiation. It is about making sure you understand the full picture before deciding. Context. Let me be clear from the start. Radiation therapy is a highly effective and important treatment for prostate cancer. For many patients, it is the right choice and produces excellent outcomes. What we are focusing on today are the trade-offs that are sometimes underemphasized in standard consultations. This is especially relevant for younger patients, those with pre-existing conditions, or those who want to preserve as many future treatment options as possible. Understanding these factors is not about fear. It is about preparation and informed decision-making. Reason 1. The side effects arrive late and progress over time. One of the key differences between surgery and radiation lies in the timing of side effects. With surgery, most effects are immediate. Recovery can be challenging, and issues such as urinary control may appear early. However, these are addressed from the start, and improvement typically follows over time with appropriate support and rehabilitation. Radiation follows a different pattern. Treatment itself is often well tolerated. Sessions are short, usually completed within minutes, and most patients continue their daily routines throughout the treatment period. The trade-off is that side effects may appear later and can progress gradually. Months or even years after treatment, some patients begin to experience urinary urgency, increased frequency, or changes in bowel habits, such as looseness or irritation. In some cases, there may be blood in the urine or stool. These effects are associated with changes in the bladder and bowel lining caused by radiation. For some individuals, symptoms such as incontinence may develop later rather than immediately. This delayed and progressive pattern can make management more complex compared to the more predictable recovery seen after surgery. Reason 2. Future treatment options may become limited. The second consideration involves planning beyond the initial treatment. In cancer care, it is important to think about what options remain available if the disease returns. This is known as salvage treatment. If surgery is chosen first and there is a recurrence, radiation can often be used as a follow-up treatment with established protocols. The reverse scenario is more complex. After radiation, the prostate tissue undergoes changes that make surgical removal more technically challenging. The tissue can become scarred and adhere to surrounding structures, increasing the risk associated with surgery. As a result, salvage surgery after radiation is less commonly performed and carries higher risks, including complications affecting urinary and bowel function. Because of this, the number of available treatment options may be reduced after radiation compared to surgery. If you or someone you know is facing this decision, consider sharing this video. Access to clear and balanced information can make a meaningful difference. Subscribing also ensures you continue receiving evidence-based health content when it matters most. Reason 3. Gradual changes in sexual function. The third consideration relates to sexual health, an important aspect of quality of life that is sometimes not discussed in detail. With surgery, changes in sexual function tend to occur immediately, allowing for early rehabilitation and clear expectations. With radiation, sexual function may appear relatively stable in the short term. However, changes often develop gradually over time. Erectile function may decline over months or years due to the effects of radiation on surrounding blood vessels and nerves. This process can continue long after treatment has ended. For patients receiving hormone therapy alongside radiation, there may be additional effects such as reduced libido, changes in body composition, and other systemic symptoms. Ejaculatory function may also change. Many patients experience a reduction in semen volume over time, and some may eventually have dry orgasm. Some also report changes in the intensity or duration of orgasm. These outcomes vary, but they are common enough to be considered carefully during decision-making. Making the right decision. What does this mean in practical terms? Radiation may not be the preferred initial option for younger individuals with longer life expectancy, as the gradual nature of side effects may become more significant over time. It is also important for individuals with pre-existing urinary symptoms, enlarged prostate, or inflammatory bowel conditions to consider how radiation may interact with these factors. For those who prioritize maintaining the widest range of future treatment options, the limitations associated with post-radiation surgery should also be part of the discussion. At the same time, radiation remains an excellent choice for many patients, particularly older individuals or those for whom surgery presents higher risks. Advances in technology have improved precision and reduced exposure to surrounding tissues. The key message is not to avoid radiation, but to understand its long-term profile and how it fits with your personal priorities. The most important step is having an open and detailed conversation with your healthcare provider. Ask not only which treatment is effective, but which aligns with your age, health status, and long-term goals. You have the right to ask questions, take your time, and make a fully informed decision. I am Dr. Ava. If this helped clarify your thinking, leave a comment with your questions or reflections. Like the video and share it with someone who may benefit from this information. Subscribe for more evidence-based men's health content. Take care of yourself. I will see you in the next video.